Ayan, hello. Good afternoon, good morning, good evening po sa inyong lahat and welcome po ulit sa ating live stream dito po sa ating dialysis warrior. Ayan, check po natin ang ating Ayan, kumusta po kayong lahat? At today we're really excited because we've got a special guest, a special colleague who would like to work alongside with us regarding dito po sa ating health education sa mga dialysis patient and sa mga CKD patient po, yung mga chronic kidney disease. And today, our topic we will be covering regarding potassium. Ayan, yung high levels of potassium or we called it hyperkalemia. Ayan po, i-share po natin dito sa my screen. Check natin. Ayan, sabi muna natin kung sinong nandito na. Ayan, mega love shoutout po kay Rodelyn Amistoso Channel. Ayan, Happy Island, RR Ramilo, Kabarong TV, hello sir, ayan po. Welcome po sa ating live stream. Sino pang nandito? Sir Axel Gonzales, ayan, si Sister Neneng Sintonado, Bella at iba pa, BJZ TV, ayan, Link of Faith, hello po, Link of Faith. Ayan, welcome po sa ating live streaming today. Ayan, meron po tayong ikukuha dito. Okay. Hinihintay po natin ang ating co-host. Yeah. Okay. Yan, she's new to live streaming and she's trying to access how to get in here. So I'm gonna put a link if you're there, Sister Verlyn. Ayan po, binaba ko na po ang link, Sister Verlyn. If you're there, pwede ko na pong umakyat. Pwede ko na pong mag-join sa akin. It will take a few minutes. Yan, mega love shout out si Bella at iba pa. Hello po. BJ said TV. Dali lang po ako'y papasok at lalagay ng inyong mga jacket. At marami pong bago dito. Yan. Bernadette Vlog present. Sabi ni BJZ TV. Okay. Let me just give you access as a moderator so you can put down your links. Ayan. For those who are new here, welcome po sa ating live streaming. Lynn Sorson, harang sir. Okay, salamat po. Ayan. Hello, Alma Boko. Tamsak po host. Ayan, thank you very much for coming, Alma Boko. Okay. So we are just waiting for our co-host to join us. Sister Verlyn, if you're there, I'm gonna pin the link so you can click the link and start joining us. Ayan, mega love shout out po kay Irene Kirit and Rhea May HK Life. Ayan po, meron na po kayong mga jacket and you can put down your link. Anyway, our topic for today is uh, all about potassium. Okay, so this is very important because this is one of the let's say, main electrolytes in the body. And our topic for today is covering potassium and its significance on kidney patients. So, yan po ang aking specialty. I work in renal department for a long time. Uh, Sino pa bang ano dyan? Nyo dyan? RJ Verdon. Okay. Sige po, magko-continue po tayo at lalagyan ko lang po kayo ng moderator so you can put down your link. Hello Team Higad, Sister Ichi Generals. Yan po. Welcome po sa ating live streaming. Okay. So without no further ado, no, let's get on to our topic. Okay, nawala na naman si Sister Verlyn natin. Ayan, nakapasok ulit siya. Okay. Sis Verlyn, nandiyan ka? Okay, good yun. I can see you now. Yan. Okay lang po. Okay, hinahanap ko rin ang aking mga buttons. Yan. So dito sa ating topic ngayon, when you have a kidney problem, yeah, you can't get rid of the potassium. So we have a condition called hyperkalemia, which is a raise in potassium levels in the blood. And we will discuss a little bit about it, what causing the causes of the hyperkalemia and how do we treat it. And most importantly, we will discuss later on what kind of food advice we can give the renal patients. And this will be delivered to us by our co-hosts who will I introduce later on. Okay, so tara po play na po tayo ng ating video. Yan. That's it to get it working. Yeah. Yeah, just bear with me lang po while I sort it out. Alright, sorry, I can't seem to. Okay, anyway po, let's while I'm trying to figure this out, I would like to introduce our co-host for today. Okay, she's one of our colleague from Queen Alexandra Hospital. But let me just tell you a little bit about her. She is a Filipino-British. She graduated her Bachelor of Nursing in 1988 in Silliman University and has taken her master's degree in there. She became a nursing administrator in 1998. And since then, she has worked as a clinical instructor for 5 years She was nurse supervisor and continuing education director for 6 years at Howard Hubbard Memorial Hospital, Dole Hospital Philippines Incorporated. And she's also an ANSAP member, which is the Association of Nursing Administrators in the Philippines from 1999 to 2001. Uh, and since September 2001, she has joined us here in UK and has worked in orthopedic and trauma nurse in here in Portsmouth Hospitals Trust until 2012. So very colorful resume for our colleague, Sister Verlyn. And now she is the founder and CEO of Healthier Choice Limited, health and nutrition registered company in the UK and authorized dealer of Saladmaster. So yan po si Sister Verlyn Jugar-Ganir. Okay, so let's all welcome Sister Verlyn Jugar-Ganir to our live stream. Hello, hello po.
Hi, hello, good morning, Haji.
Kumusta po?
It's
Kumusta?
actually good afternoon na pala. Alas 12 na.
Ayaw nga pala, lumipat na nga pala, no? Oo.
Yes, that's right.
Naggagaya ko kanina, morning pa.
I'm
For
so
some
happy
reason,
I managed to go in, ha? This is my first time to the live streaming.
no, it's actually the video and audio is very good.
Good.
I wasn't expecting it would be, it would be good. So, welcome po sa ating live streaming, Sister Verlyn Jugar-Ganir.
Thank you.
And we're happy to have you today and grace us with your knowledge on dietary, expertise.
Sana, okay? I'll do my
Yeah.
best.
Yan. Yan po. Maganda po ang ating Bago po kayo magpatuloy, sister, let me just balikan natin itong mga viewers natin. Okay. Para po mabigyan natin ng kansela. Mute natin ito isa. Right, so hello there to Ron J.S. Guzman. Ayan, Team Higad, Camiguin, Island Kusina. Ayan, sino pa nandyan? Divina Bakunawa. Ayan, lagyan muna natin kayo ng mga kwan para makapagbaba po kayo ng inyong link. And in a minute, while Sister Verlyn is getting ready. Ayan, sino pang bago dito? Ayan. Mega love shoutout po sa lahat. Hindi ko na po kasi sa-isayin dahil po napakarami nyo dyan. At salamat po sa inyong pag-support sa ating live stream today. Okay. Ayan. Yeah, I was struggling to get our video up, Sister Verlyn. So, teka muna.
Oh, is it okay now?
I'm trying to, I'm still trying to figure out
how to share.
How to share
That's
it.
one thing would probably my what do you call this? My challenge later on. But if I would share some slides, but we'll see how we get on.
See how we get on. Yeah.
Okay. No problem.
Okay, we'll try to share a video file and see if it's gonna work. Okay, and this is just a small. A small demo on let's see sister if we can share this one. Okay, it seems to be good.
Yes,
seems to be all right.
Yeah, lovely.
Okay, so normally po kidneys are responsible, in filtering in normal circumstances, filtering the electrolytes and potassium, and all the waste products becomes a wee, goes in the bladder and become a urine. So that's how we know. So today we're gonna discuss about hyperkalemia. Okay, so it means hyperkalemia po is a potassium, very significant body mineral. It is one of the main blood minerals called electrolytes. So others are sodium and chloride. It carries a tiny electrical potential, and it's critical to the function of the nerve and muscles, including those in the heart. So it helps the body regulate the activity of the muscles as well, maintain normal heart and electrical rhythm. So it also regulates the water balance and acid-base balance in the blood. So potassium is found in wide range of food, such as fresh fruit and vegetables. So all those in the list in there.
Yeah.
As you can see, mostly, like avocados, bananas, they contain whole grains, nuts, and salmon. This contains rich in potassium as well. So the normal blood potassium level is normally 3.6 to 5 millimoles per liter.
Yeah.
And the severity of hyperkalemia is divided into mild, moderate, and severe. So potassium level between 5.5 to 5.9 millimoles per liter reflects mild hyperkalemia. Potassium level between 6 to 6.4 is a moderate hyperkalemia, and levels above 6.5 millimoles per liter are severe hyperkalemia. So circumstances that interfere with potassium levels can affect electrical impulse necessary to sustain, abnormal heart rhythm. Yeah. So those are the causes. Yeah. When the kidneys dysfunction is unable to remove potassium the right way, and too much of it stays in the blood.
Para higher. And the window open. Yeah.
So medications such as beta blockers, ACE inhibitors, NSAIDs, yung mga painkiller po natin, angiotensin 2 receptor blocker, dehydration, ayan, type 1 diabetes, diseases of the adrenal glands such as Addison's disease, rhabdomyolysis, and internal bleeding. Symptoms: feeling tired or weak, unusual or irregular heartbeats or palpitations, chest pains, trouble breathing, nausea, muscle pain. So diagnosis and treatment. The diagnosis may involve taking your medical history and carrying out a blood test. The blood test measures the level of potassium in the blood. The blood test is like many other. A small needle is placed into a vein in your arm, and your blood is drawn out into a tube and then sent out to the lab to be tested. An electrocardiogram or ECG will also be done to check the significant risk of abnormal heart rhythm. So treatment may depend upon underlying cause, the severity, and the overall health status of the patient. So mild hyperkalemia is healthy individual may be treated without any hospitalization. If the condition is severe, an emergency treatment that includes hospitalization in the already intensive care unit under continuous heart rhythm monitoring may be necessary. The goal of treatment is to help the body get rid of excess potassium quickly and stabilize the heart. So hemodialysis is the most rapid method of removing potassium from the body. This is the best treatment. So hemodialysis is a machine to remove waste from the blood, including excess potassium when the kidneys cannot. So prescription drugs may also be used when the high potassium levels, such as diuretics, pills, increase potassium. Yeah, loop diuretics is included as well. Thiazides, sodium polystyrene sulfonate as well can be used as well. These are new medications. So you may be advised to stop or change medications that are continuing to your condition. A low potassium diet per day, intravenous administration of insulin which is given when appropriate amount of glucose. So yan po ang that are the causes of hyperkalemia, causes, diagnosis and treatment, and how we intervene with hyperkalemia, which is very dangerous, especially with the condition of chronic kidney disease. Uh, it sometimes needs to be medically treated. So, so we don't end up having to go on medical treatment. That's why we're trying to discuss today and invite Sister Berlin to, educate us about more on diet side of, potassium. So we will remove this, and then we will. Here you go. Sister Berlin is back again. Let me just put my OJ back in there. Okay.
Yeah. Okay, hi, hello, good afternoon or good evening, especially to our fellow Filipinos in the Philippines. Yeah, probably it's around 8 o'clock there. Yeah, mga alas 8 ng gabi. But of course, it's actually like midday here in the UK. It's around 1 o'clock somewhere in Europe. Thank you, Haji, for, asking me to at least share a little bit about my knowledge on hyperkalemia or increase potassium level in bloods. And I really love your presentation. I mean, it's very easy and simple to understand. Quite concerning when we talk about, chronic kidney diseases, particularly in the UK, is about 3 million of people actually are affected of this. And I think this is common all over the world. I am very concerned because especially in the Philippines, marami kasi tayo mga Pilipino na apektado din na nagkakaroon ng problema sa ating kidneys, no? And I know that it's not only medication or dialysis that would help ease off
Yeah,
the symptoms
definitely.
of, yeah. So there is also a role here on nutrition, or particularly in food. Now, as what has Haji has said earlier, that I'm a nurse by background, yeah, and but I have decided to widen my horizon in terms of sharing knowledge into health and wellness. So that's why Healthier Choice was born. It's because I believe in power of nutrition, and there is a lot that we could get out of the food. Now, particularly in hyperkalemia, we have to make sure that we have to minimize the potassium level in our food. So there are some few tips that I would share this to you. Of course, initially, Haji has shared those kinds of foods that are really high in potassium content, especially in the Philippines, because we have loads of root crops, we have loads
That's
of
right. Yeah.
bananas, yeah, we have loads of kamote or
Yeah.
potatoes, cassava. We have a lot of nuts. We
Sis,
and yes,
Sister
generally,
Berlin, it will
yes.
be
Can you
nice
hear me?
to yeah, it will be nice to share both foods here in Europe and Philippines as well,
Yes,
because we have a
that's
lot
right.
of participants here from Philippines.
That's great. Yeah. So,
Yeah.
but there are common, these are like common vegetables in the Philippines that are rich in potassium, like our cacao, our chocolate, for example. Okay. Our nuts, all kinds of this. And because we are in the tropical country, most vegetables that grow are greens, like leafy greens, are green vegetables. And there is always potassium in that, apart from other essential vitamins like vitamin C, B, and others. But we're just going to be specific on potassium contents. Now,
That's
um, so we need to do something about control, minimize the potassium in our food. I don't know. Let me just try. I don't know how to share like a slides here. This is my first time. I normally just use as a Zoom, and so I
yeah.
don't know if I could open. I think what I can do later is just to see what it's like to share, because here I can actually let me see a video file if I can. Let me just check if I can. Right. Or like a PowerPoint maybe. Let me see. Um, because there might be some way of doing it. But if not, just bear with me, guys, because this is my
That's all
first
right.
time to use.
I've been
Now, my
doing live stream, but I'm still having problem with it.
okay, okay,
So
right.
it's all right.
Uh,
They're not gonna go anywhere.
yes, we are not, IT expert here, but I think there is a
No.
way of sharing it. Let me just check. It says here I can share video
Yeah.
file, but there is none as a document. But let me just try
Is
what
it
we
is
can.
it under your document, sister?
It is a PowerPoint actually. So I've got it
PowerPoint.
here. Yeah. So um, let me just, if I share screen, screen is to monitor share. Oh, no, no, it cannot be. That's
I
not a
think
share screen.
if it's on the tab, if it's in
Yeah.
your tab on the top, you can share screen, not the video file, the other one. Share screen and
Uh-huh.
whatever. Yeah.
Let me see from here from the PowerPoint if I could share it to. Oh no, it's not a touch screen instead. No, it cannot be. All right, okay. But anyhow, let me just go back to you where you now. Um,
While you're looking for that, sister, let me just
yeah,
mention everyone that's
yeah.
on
Can you
view at the moment. There's Orlando
come
Oo
on
is watching. Alma Adamos,
green
Clark
screen?
Nicolas, Vic. Hang on. Vicky Sinclair is watching. Shirley Franco and Sharon Asuncion. And yeah, here in YouTube, Ranji S. Guzman, hello po. Ichi Generals, Mads Chloe, tamsak na po host. Ayan. Thank you po sa inyong mga patamsak dyan. Rodelina Mistoso, mega mega love shout out po sa lahat. Earl Kenji Vlog, yan. Thank you po for coming. Let me see if we got the moderator. Dalby in KSA Vlog 7. Emily Pando Vlog. Hello po, Kabsat. Ayan, meron na pala siyang meron na siyang jacket. Ayan. And Ranji Egg S. Guzman. Hello po. And Lynn, ayan, Sister Lynn Sorson. Ayan. Mega mega love shout out po sa Team Higad from Ichi Generals. And thank you, y'all. Thank you for supporting our live stream. RJ Berdon, hello po. Ayan, bago yata ito si Sir RJ Berdon. Ayan, hello Lynn. Ayan po, nagbaba po ng link si Divina Bakunawa. Ayan. Meron na po siyang And ayan, mega love shoutout po kay Chel Flora Channel. Okay, sige lang po, magbaba lang po kayo ng link dyan while Sister Verlyn is trying to find her video link. Ayan.
You know,
So,
Haji, the only way I could share is like it's either a screen or a video. So, but the slides that I'm using is not like a movie or like a video presentation. So I don't think I could
oh,
do that.
I
Maybe
see.
next time I think I could do that. But anyway,
Okay.
is it
Yeah.
okay for me to proceed? Yeah.
Yes, yes, of
So
course,
what I'm
sister.
going
Yeah,
to
yeah.
okay, great. Okay. Right. So what I'm going to do is I'm just gonna do a little bit more on uh what sorts of food that we could make sure that it is low in potassium. Although some people would have difficulty like changing the food that they want to eat, as what I've mentioned earlier, like we always have a favorite food to eat, right? We all have also certain vegetables just to eat. You don't wanna. Some people are scared to try new vegetables on their plate. So there are simple tips here, definitely. Now let us look about you. It's nice that you mentioned already the safe zone, how much level of
Yeah.
potassium should be in our blood, and what when is the alert zone, and when it is really at the danger zone, especially when our levels of our potassium is more than 6 millimoles per liter of
That's
our
right.
blood.
Yeah.
Yeah, so and then if it goes that, then we have to do something about it. Now of course, we also have to consider with diet modification, which I am going to focus more on, is that what is the cause of your kidney problem, and then obviously it leads to hyperkalemia, because we know that if there's too much potassium, it's not good. Anything which is exceeding is not good. So we should always be in the middle, or at least below or moderate, right? Now, as what I've said earlier, bananas are very common everywhere, all over the world. Potatoes are almost everywhere, all over the world. We have
Yeah.
different kinds of potatoes. We have the normal potatoes in different variety. We also have sweet potatoes. We have loads of broccoli. Okay, we have loads of green vegetables, and we have loads of beans and peas. But most of them really, and nuts, whole grains, are too much of potassium. Now, as what I've said, if you cannot easily get out of those food which are your favorite, then what you could possibly do is minimize the potassium content in all of those foods. So let's go on that side first. Now, for example, for vegetables, which is very, very high in potassium, most people would, even experts would advise that we have to peel our vegetables if they are high in potassium, like your potatoes, because nutrition says that most of the vitamins of root crops sits right under the skin. So if you're going to remove the skin, you minimize the content of those major nutrients in your food. So you have to peel. You soak those vegetables many times in water, maybe every 1 or 2 hours, 5 to 10 times, just to remove all the excess of the
That's
potassium
right.
content.
Yeah.
Yeah.
This is what they
And then,
suggest as well on the renal patients. Boil it
yes.
three times. Just to get
Yes.
rid of potassium.
Yes, and
Yes.
also when you boil your vegetable, you have to boil at least 5 times. For example, if you have 1 cup of potato, which is cut into strips or into cubes, if it's 1 cup, then you have to cook it in at least 5 cups of amount of water. And then you are not going to drink the soup out of that. Instead, you throw it away and
Throw
eat
it
your
away.
potatoes. Yeah. Okay. So exactly the same. If, for example, in the Philippines, because we have loads of root crops, like as what I mentioned, you do exactly the same. So for any vegetable, so it only tells us that the most important thing when we think about lowering the potassium levels in our food intake is, of course, we should be mindful of looking at the foods that are low in potassium. So we have certain, like vegetables and fruits. So there's a lot of suggestions actually, but I cannot mention everything. But if you think about low potassium, we should be thinking about common fruits like apples, berries, yeah, kind of mangosteen. Mangosteen is like very common as well in the Philippines, but not much here in Europe. We also have some like grapes. That those are also some fruits that are low a bit of potassium. Watermelon, yes. Turnips, or I think it's singkamas in the Pilipinas, right? Is it
Yeah,
a
it's
fruit or is
income.
it a vegetable?
It's
Singkamas.
another root crop.
Yes, it is. Yeah, that's right. So, I don't even really sure
Mm,
whether it's a fruit or a vegetable, but root crops, I think, is more vegetables. So anything like we say tubers, like our taro, our gabi in Bisaya, so those are root crops. So, and yeah, so pineapple is also low in potassium. Cabbages, yes. We have also our we call it something like sponge gourd, patula. We have patula in the Philippines.
gorge, patola. Yes, yes,
Yes,
yes.
gourd. Yeah, we
Yeah, yeah.
also have the opo, chayote. Yeah, it's those are some of the vegetables. Eggplants are low in potassium, and our beans, like green beans, like it's a long string beans, or We commonly here in the UK, what we have are fine or beans, green beans, and we also have broad beans. Those are vegetables that are low in potassium. We also have onions, and we also have the different kinds of, like, especially peppers, sweet peppers, cabbages, bean sprouts. Sorry. So if you look at it in a general perspective, in hyperkalemia, what we are really mindful about is look at the foods that are low in potassium. Now, we also need also to look into portions. When you say portions, it's not all just about the food that we eat. It's about the amount. So in terms of milligrams, or in terms of meals, any a portion, I think in hospitals we normally use this. When you say portions, it's always entails about like half portion, like let's say half of the cup or half of the glass, or half of the tablespoon. So that's always like that. So one a portion, half cup of anything. For example, okay, you're allowed to cook. You're allowed to eat different kinds of vegetables and fruits, like 5 to 7 kinds of fruits and vegetables, but it should be in portions. Now, particularly in kalimia, as what I have read, and as I have also would like to consider, that the amount of potassium should not exceed at least more than 2,000 milligrams. Is that right? Well, you can tell me, Haji, if I'm, because you're actively in the renal practice. How much, milligrams of potassium is allowed for a patient with hyperkalemia? Is it around 2,000 or less than that per day?
I'm not specifically sure, Sister Berlin.
Okay, okay.
Yeah,
Because
I would normally just go with like blood levels.
yeah,
You know,
yeah, because
that's
you are more on
how
the
we measure it. We're more in clinical rather than
yeah, you're on the more on the clinical side. But if you have a
yes.
patient, if you have a hyperkalemic patient in the ward, how often do you check the potassium levels?
We do it daily.
Okay, daily. So
Yes, but
it's good. It's
uh,
good.
ju- just to let you know, guys, renal patient, even if we put them on a low potassium diet, because as Sister Bernardine was saying, you get most of the food, you get potassium on it. So
Yes, that's right.
we'll just try to give them a low potassium diet. So there is still potassium, but it is a low
Yes.
potassium diet. The
Yeah.
problem is if your kidney doesn't work anymore, then it doesn't get rid of that potassium, and then eventually it builds up.
Mm.
So it's very dangerous when it's high because it can cause heart arrhythmias or
Yes,
any abnormal heart rhythm.
that's
So
true.
in clinical setting, we do check the potassium every day, just to
Okay.
make sure that they're safe. But with regards to milligrams, I wouldn't be the expert.
Okay. All right.
It
It's
will be
good
a
because
diet expert like
yeah.
yourself.
Yes. Because it's nice to know that, in the clinical setting, the potassium level is checked, every day. At least for example, if I am the meal planner, if
Yeah,
we are really religiously observing this in the hospital setting, then it's easier for the dietitian or nutritionist to plan
yes,
individually the diet of each patient, because each patient is different, right?
that's right. Right.
So as far as I am, educated about in terms of hyperkalemia, because I'm also studying, my study in nutrition is still ongoing at the same time. But I think the content or the whole potassium should not exceed every like 2,000 milligrams each day. So it's like at 24 hours. So for example, if you have a half cup of what do you call this, a vegetable, like let's say for example just broccoli, because that's quite high in potassium. So if you have half cup of that, then more or less this is like about less than 200 milligrams of potassium. So you are only just allowed half portion of each vegetable that you can eat every day. Now, if the vegetable is lower than potassium, then if you use a portion, of that, then the lesser the potassium level is. Now, of course, we could not totally get rid of the potassium because it has essential also function in our body. The only thing here is that we have a diseased kidney, which is unable now to filter all the waste products in our body. So that's why we have to be very careful to regulate the potassium level, di ba?
That's right.
So
Yeah.
so kailangan natin na ano kasi more or less as you have said, the patient could develop some arrhythmias, and if it's not regularly corrected, that could end up to death because
That's right. Exactly.
it
Yeah.
can cause cardiac arrest or anything like that, secondary to renal failure or to kidney failure. So it is very, very important that if we have already problems with our kidneys, we really have to be mindful about our food. Guys,
That's right.
I do believe,
Yeah.
that we are what we eat.
Yep.
So it would affect whatever we put inside our body, it will, come out. Now, it's okay if we still have healthy kidneys, we have healthy bladders, we have healthy heart, we have healthy arteries and all that, because this is the way of we can still enjoy the food that we can have in life, and our body is still able to what do you call it, process, and then essentially get rid of and not necessary and keep the necessary ones. But we have now a very diseased kidney. So those are simple, a few vegetables and fruits that I can think of right now. But let me just go back to, for example, preparation and cooking, because this has a big role in lowering the potassium in our diet. We have mentioned earlier, of course, we have to look at, if you are into like canned or processed foods, you don't have the chance to cook. I think I would advise you look at what is it in the label, or the nutrition, the recommended daily nutrition at the back of the label of your food. It will tell you there what are the essential vitamins and minerals, and then is it high in potassium or low in potassium. For example, let's talk about canned fruits. Yeah. There might be, it could be like fruit cocktail. Most of the fruit cocktails are pineapple in there, right? Cherries, maybe some pears, different fruits. But the thing is, if you want to be very careful about potassium, you only just eat the fruits, throw away the syrup out of the can, and just eat the what do you call this, the fruits. And in vegetables, as what I've said, anything which is high in potassium, we have to remove the skin, wash it, soak it many times, and then we cook it, and boil it and throw away the water out of the cooking. At least we minimize that potassium content. As what I've said, if you're going to soak it, you soak it at least 8 to 10 times the amount of the vegetables that you're soaking, and then you cook it 5 times. The amount of water should be five times in the portion of your vegetables. But and also, if you have a way of checking how much is the potassium level of each food, I think I don't know. I have not really checked this very carefully, yeah. But I think in passing, I saw before, and I want to visit this now. There is like how to calculate. For example, a cup of a particular vegetable, for example, broccoli, zucchinis or courgettes. Because as what I've said, anything mostly green like kale, there's a lot of potassium in there. So what you need to do is, in order to calculate how much only milligrams of potassium that you can include in your diet, I think there's something like a calculator, or like how to weigh, how to measure, the amount of potassium in your food. Okay, so now in hyperkalemia, we cannot also get rid of proteins, right, Haji? Because we
Yeah.
also need proteins, and
Yes.
common main common sources of our proteins are our meat and poultry. So, for example, particularly egg. These are lot of many things: vitamin D, other essential vitamins. There's a lot of protein in there as well. So, the portion of the egg that you can have is not the egg yolk, but it's more on the white to minimize the potassium level. And with meat and anything like beef, pork, or anything like chicken and all that, so it's just a small portion of that. So it is very, very important that in your plate, we will say, if you divide your plate into portions, very small amount only of your meat, okay, half cup portion of your meat, and all the rest is a half cup of different vegetables. Now, I am very concerned about choosing the vegetables and fruits, because, as what I've said, there are really vegetables and that are full in potassium. So I would suggest try those with low potassium. Um, Low potassium vegetables are commonly, as what I mentioned, in the Philippines. What I can think of are, of course, our string beans, our eggplants, what do you call it? Turnips or singkamas. Yeah, because you can actually use singkamas as like chestnuts. You can use that for any of our soups and our stews. We can add that, and of course we have our radishes. These are also low in potassium. Here in the UK, I was so surprised because the radish here are like so small,
It's a
and then
small
it's
one, yeah.
red. Yeah, and in the Philippines, we're used to see like, yeah,
The,
and
the big ones, yeah.
very common vegetables that is also not only just low in potassium, and but a lot of vitamins in there, especially vitamin A and vitamin C. Is your carrots. Your
Yep.
carrots are also low in potassium, and the good thing with that, it is a lot of vitamins and minerals. Oh, next time I have to make a video, a movie, so that I can share it here. Yeah, yeah, because I did not know that I cannot share the
Yeah,
PowerPoint in
that's
here.
all right.
So
You're
I'm
giving us a
learning.
lot of.
Yes, I'm learning. And also,
Yeah,
guys, in here in the UK, common vegetables are, of course, cabbages, cauliflower. We have lettuce. Cucumber as well is a little bit low in potassium, and so these are the common, like carrots is always here, bell peppers,
it
and
is common. Yeah,
that's right, very common. And fruit, the common fruits that we have here in the UK, in terms of low potassium, are apples, berries like blackberries, cranberries, and including the juices as well, and mandarins and clementines, because oranges has high potassium. So just imagine, they belong to like in the same family, but the oranges like are more of potassium. So they just recommend the mandarins and the clementines. So and talking again, and other fruits that are available in the Philippines, in terms of low potassium, of course, I mentioned mangosteen. We also have rambutan. Are you familiar with rambutan?
rambutan. That's very common. Yes.
Yes, we have that in the
Yeah.
Philippines. So those are vegetables, and we just have to be very, very careful really with the vegetables that we eat. Of course, sibuyas or onions are low in potassium,
I think they're
and it
worried, sister. They're worried that once they have a kidney failure, then they won't be
yeah,
able to eat.
to eat.
Yes,
Yes, that's right.
yeah. So
Yeah.
it's
No,
good
no.
that you mentioned about how you would prepare it, how you would cook it, and how you would minimize the potassium content, so you can still enjoy the food. You know.
Yeah.
Yeah.
There's another one that are very common in the Philippines. Malunggay, moringa.
Ah,
Yeah.
yes, very good
This is
moringa.
now worldwide called a miracle plant.
Miracle
Yes,
plant. Yes.
yeah, a miracle plant. Yeah, it has been
Yes.
studied carefully, and we are so guys, we are so blessed that we get this almost everywhere in our backyard, or
Yep.
we can just easily grow this. But this is high, very very high in potassium. But we love our malunggay, right? So, like for example, if you're going to for particular for Filipinos, if we make tinola or anything like that, I just realized when I was reading about moringa, the longer you keep it, and the longer you dry it, the more potassium in it. So so it's so funny. So if we're not really doing our research,
Actually, that
simple,
applies in banana as well. The longer you
yeah,
keep the
that's right.
banana, the
Yeah,
higher the potassium you get from banana. Yeah,
yeah, that's true.
interestingly.
Yeah, but with malunggay, because especially me, I grew up in a farm, so we have loads of malunggay. It's like a fence in our farms in the house, and there's loads of malunggay. So it's very good, of course, in cancer, in diabetes, and all that. But when we already have hyperkalemia, it's not safe.
No.
But the best way to do that is just a small portion of your malunggay if you feel like, because guys, we're not asking you not to eat, but at least modify and minimize just the potassium content. So for example, we talk about malunggay is if you have tinola, you're about to finish your tinola and you're about to serve. The best time that you add your a portion of your malunggay is just right before you serve. So you do not really overcook it, because or else you got loads of potassium in your soup. So yeah, a small portion will at least not really endanger you in terms of potassium, because I think 3 or 4 times higher in terms of potassium and level of your malunggay. So small portions. Spinach. I didn't realize spinach has also high in potassium. And
Everything that
munggo.
you eat, yeah, everything that you
Exactly.
eat
Just
has got
imagine.
potassium.
Now I was looking at, oh
Yeah.
my God, that's why Asians and like Filipinos like us
Yes,
are really prone to renal problems, because most of our food has high potassium as well.
that's true.
Very high in potassium. Like for example, it's okay if we're healthy, as what I've said. So
Mm.
spinach is also high in potassium, and potatoes, and I love potatoes, and I'm still okay because I don't have any renal problem. But as what I've said, it's look at the labels of or anything that you plan to eat, and look at any information, that's a lot of potassium, and which one has less potassium. Of course, when your potassium is already high, so we always go to low potassium uh, foods. Yeah. And also we have to adjust the content, the amount of the food that we eat. That is very very important. And it should be also that our food is really planned carefully, that we are at least our plate is full of other vitamins and minerals, because of course our muscles, the heart, our kidneys also need certain essential vitamins and minerals for it to function. So it's really amazing that there's so much that we can really do with our food. um is there anything that is there anything that you want me to talk about? Maybe I would be led more if there are questions. If you can ask me questions through the chat, or maybe through Haji. um you might also have some other particular
Yan,
food that you have been eating, that you really love and you cannot give up, and maybe we can do something about it, especially yung mga paborito natin sa Pilipinas,
yan.
yeah, mga igado,
Mm.
internal organs, and things like that.
Yung mga ano po diyan, yung mga Ilocano, ha?
Oh
They like
yeah. Oh
they
yeah,
like all
yeah, that's
the
right.
dinding, ayan.
Yeah, oo, at saka
Ah,
mga
yan,
pinakbet.
pinakbit.
Kasi ang
Ah,
gustong-gusto natin sa pinakbet yung ano, 'di ba,
mm.
yung ampalaya at saka yung kalabasa. Mataas din yun sa potassium.
Yun nga eh. Yan guys, if you have any questions, yan, you can post your comment down below in there. And
Yes, please.
Sister Berlin is very well versed on dietary ano. Yan. Siya po ay nag-aaral ngayon
Yeah.
continuously. Yes.
Yes,
Ah,
that's right. Ano pa
Hintayin
ba
po
ang
natin sila.
oh, Maybe we can talk about as well mga gatas or something like about breads and rice. Okay. If we talk about, if there are no other questions yet, but I will just take this opportunity about talking about milk and substitutes. Because
Okay,
of
there.
course, 'di ba, kailangan din natin ng milk, more or less. Well, I'm not really a milk drinker, but I use some amount of milk in my food, especially in the morning, like cereals and all that. But in milk, we are allowed up to 300 meals of any kind of milk each day.
Which is what, 1.5 glass, isn't it?
Yes, yes, around 300 meals. That's what I've also checked this with the National Kidney Institute. Is it National Kidney Institute in the Philippines?
National Kidney and Transplant Institute. Yes, yes,
Yeah,
that's correct.
okay, yeah. And I don't know here what is the our counterpart here in the UK, which are regulating the, is it
Well, there's
national?
ODT, organ and donation transplant, something like that.
Okay, okay.
Yeah.
So with milk, we are allowed at least 300, meals of milk each day. So what we could do, if you mix it into your, to your tea, for example, so you can just, change into portions, maybe just 125, 100 or 100 mils if you want to spread it out during the next 24 hours. The only that you can generously drink what sort of what do you call this milk is because we have now like nut milks like almond and all that, which is high in potassium, isn't it? But
Yes.
I think oatmeal milk is low in potassium, and rice milk. They also now making rice milk. And oh, I just remember as well, you have to be very careful. Filipinos are very fond of ginataang gulay
Yeah.
with coconut milk. Oh my God! Coconut water, anything which is coconut, anything which is palm is loads of potassium, and these are the
Anything
food that
canned.
in
Yes. Yeah.
yes. So coconut is very high in potassium as well. Even the buko, like ang sabaw ng buko is really full in potassium. So low portions of
No
this,
portion.
because these are, yes, small portions. And yeah, so as what I've said is with milk, we can have max of 300 meals over the last for 24 hours, so we can have milk each day. As to because Asians, of course, even like the Western people would not necessarily eat rice, but most of they use is more of pasta and breads. Now, when we talk about pastas, it should be like, like the plain ones. And when we talk about breads, the plain ones, not those with seeded, like multi-seeded or with nuts. So it's just plain breads. And also same thing with rice. And with rice, of course, in order to, because we don't need also too much carbohydrates and all that, we have to minimize the amount of rice that we eat. You leach it, just like the vegetables as well. You have to wash it many times before you cook, and minimize the portion, and include in your diet more of the vegetables and fruits that are low in potassium. Or else, if you love to eat those high potassium content vegetables, you have to leach out the excess potassium in your food, so it's safer for you, and safer really for our body. Yeah. So yeah, so guys, if there are
That's
questions,
good.
of
Yeah.
course, I'm very happy to answer. If and anything from your end,
I
Haji.
think. I think. No, I haven't seen any at the moment. So, talking about milk, Sister Berlin.
Yes,
Maybe next time, because phosphate is one of the problem as well with our kidney patients. So we
yes,
will we will cover more of the phosphate
milk.
and the
Yeah,
milk and dairy products,
yes,
because this tends to build up in the system and cause a lot of problem as well. So
yeah.
problem with the
Wow.
bone, problem with the skin. So lots of
Yeah, my gosh.
things.
So many things to think about, isn't it?
That's right. So
So many
it's
things.
another topic, we could cover, sometime. But you have given us quite a lot of information on, about potassium, and people that
Yeah.
hasn't watched the video, I'm sure, when they watch this again, they'll realize, how, you know,
So,
l-
can this video be
most
watched in the future? Can
it
this
will
be
be.
watched?
This is recorded, Sister
Okay.
Verlyn. So you can
Okay.
share this, to your friends, your colleagues,
Okay.
whoever wants to learn more about potassium and how to to eat a low potassium diet.
Yeah.
I'm not,
Maybe
you know,
next time I can show how to really, like a video on
yeah,
how to, to cook healthy foods, because especially with renal, like kidney problems,
yeah,
it's quite a special, diet plan. At the same time, I think we focus more on preparation and cooking, and measuring the amount of potassium in our food, especially if someone is already having hyperkalemia. And yeah, that's it. It's really interesting, and I'm really happy that at least I can share a little bit of that, based on what I've learned in the past, and as well as I'm studying nutrition at the same time. And this is why, I always look at the healthier side always,
yeah.
because it's more on, although my focus is more on really prevention, but I didn't realize that we can actually more share more of our experiences, and at the same time a little bit of knowledge onto the curative and rehabilitative stages, especially
That's
if
right. Yeah,
people are already suffering advanced renal problems. And
yeah.
yeah, that's true. So it's really good. And guys, I hope I've added a little bit about information to you today, and and I'm really more than happy to answer your questions. And yeah, and I'm so
Lovely.
thankful that I'm here. I'm part
Oh,
of
thank you very
this
much.
group. Yay!
This is just the beginning. You'll see more of Ate Berlin, and
Ah,
she will, hopefully, she will share us more of her knowledge, on diet. Yes. So, it's a pleasure to have you on board, and
thank you.
grace us with your knowledge. And yeah, we'll talk about more about other, about anything about diets.
Yeah, of course, I could
Yeah,
not mention
yeah.
everything here.
No,
Yeah. So there are
we
just
try
few that,
to
yeah,
concentrate on the potassium side
yes.
of food, but as you mentioned, it's just so wide. There's too many. Oh, most of them actually has contain potassium, whether it's fresh or
True.
canned.
Exactly.
Yeah, it's got
I was
it's
like,
got
how
potassium.
can
Yes,
we remove that potassium in our
you
food?
can't.
Because
You
most
can't.
of our
No.
food has potassium.
Even the dietitian will just recommend a low potassium diet, but no
No
non
potassium
potassium.
diet.
Yeah.
Yes, that's right.
Yes. Ay, nako. Well, ayan, yan, marami po tayong we've got, we just do a bit of shout out here. Shirley Pascual Reyes still watching. Danny Valdez Laurente from Australia. Yan,
Wow.
watching. Yan, watching si Sir Danny. Elena Hoson watching from Nueva Ecija. There you go.
Wow.
Nako, at saka po dito sa side natin marami pang nanonood dito. HC Generals, thank you very much for coming. RJ Berdon, nako kung isa-isahin kayo, napakarami niyo po. Ran J. Costillas, Lynn Sorson, Chel Flora, Mom's Life, Trouble. Ayan, marami pong naka-tune in sa atin, Sister Lilibet Flora, Ikalingan na ako din na Mistoso, Rhea Toffer, yan, Rhea Toffer, Emily Pando Vlog. Ayan. Dudes Abayon. Hello, sir. Yan. RJ Berdon. And Wonder Melay. Ayan, dami po nilang nakatune in sa atin. So, Ninja ni Dalby in KSA, yan po, from Middle East. Ayan, so we've got lots of people watching, from all over the world. And thank you for tuning in. Ayan, at marami pong salamat kay Sister Verlyn Jugar-Ganir. Yan, sa
Very
kanya
welcome.
pong,
You're very welcome
sa kanya
anytime.
pong napakagandang information.
And I'm loving your program. As what I've said, the first time I saw it like,
Yeah. Na-mute ka, sister. Na-mute. Ayan, na-mute. Yeah,
sorry,
okay.
sabi ko nung nakita ko
Yeah.
yung first for the first time I've seen I was just browsing my Facebook and
Yes, yeah.
I saw what you did. I said, wow, this
I
is
can't
really
remember.
amazing.
What was that topic? Was I talking
I
about
think you were talking about CKD.
CKD?
Yeah.
Yes.
Yeah.
Because I'm also part of
Oh,
this.
no, sorry. It's AKI.
Oh, AKI. Yes, yeah,
Yeah,
AKI.
that's right. Yeah. Mhm.
Yeah. Before I was taking, like questions from, because we're part of the dialysis support group here in UK, both in UK and Philippines. So there's just common questions, that they ask. But it's I mean, it's expected. If you're new to this renal problem, you wouldn't have a clue.
Honestly,
You
yeah,
know,
that's true.
even like simple diet, what to eat. This is very common. So like having you here, and giving us this information, it will help a lot of people. Both here in, well, all over the world.
Yes. We cannot stop
Not
eating.
only
We cannot tell
yes.
the patient if you're a renal, no, don't eat. Yeah.
No,
We
we
can't.
can't. You can just tell them, what are the options you can do. Like basic things like wash it several times, boil it several times, peel the skin,
Yeah.
simple things like this. It will, at least they can still enjoy the food that they would like to eat.
Yeah. And also
Yeah.
portions. Like we need
And
to
also
control the
portion.
amount. Yeah, yes.
Yeah.
We need to control the
E-
amount of
e-
food.
even the healthy ones we need to control.
Yes.
It doesn't mean we're healthy. We can eat what we want. So
Exactly.
everything goes in moderation. And yeah, as they said, you use the food as your medicine,
Yeah.
or you
That's
will
right.
you will take the medicine as your food.
Oh wow, I love that because I always shout out that slogan of
uh,
Hippocrates, the father of medicine in all my presentations. I always,
yes,
put that always at front before I start everything.
that's
So
true.
yeah,
That is true. Yeah.
and
Mm. Yeah, and Shirley Pascual says, thank you for the very nice info about diet to keep
you're
our kidneys
welcome.
healthy. Good job and keep it up, paring Haji and Ma'am Berlin. Ayan po,
Oh,
from
thank
Shirley
you.
Pascual Reyes. Ayan, we were having lots of audience now. Ay nako, maraming salamat po, Sister Verlyn Jugar-Ganir, at
You're
we're
welcome,
very
sir.
happy. We're very happy that you came up and educate us. So I will see you po next time again, and we will chat about more about this.
Yeah, sure.
Yan. At tayo po'y lalaki at lalaki pa.
Salamat.
Ayan,
It's
ayan,
nice.
salamat.
My best take for today is that this is the first time that I have been on live in YouTube. I've learned a bit, and I know now that I could not share a PowerPoint. Maybe what we could do is what you did, like like a video.
A
I think
video,
that's
yes.
possible. Yes. So I think I just need to learn a little bit more on like something like a video, um, or maybe like a movie thing that we can easily share in terms of what topics that you will be talking about, and then I will be talking more about on the nutrition side.
Opo.
I will do my best. I'll do my best.
Yan po. And mega mega love shout out po sa ating Healthier Choice Limited. Yan po. At very happy po tayo, nandito po ang ating founder and CEO. Ayan, Integrative Health and Wellness. Ayan po.
Yes.
Salamat po ng marami, sister.
Okay.
Ayan
Yeah.
po. I'll see you later. I'll speak to you later. Thank you.
Okay. Okay. Bye.
Bye-bye.
Have a
Bye.
good day. Bye.
Bye-bye. Ayan. Maraming salamat po. At yan po si Sister Verlyn Jugar-Ganir. Ayan po, napaka-knowledgeable po niya sa nutrition. And she's still continuing on learning more, about this nutrition. And yan po, productive ng ating live streaming today. And hopefully nagustuhan niyo po ang ating presentation today. And before I end up yung live streaming po natin, I just want to shout out po dito sa ating mga channel members. Okay, start from Only Nedge. Yan po. Rodelyn Amistoso Channel. Jilan Sheen. Team Doremi. Lalin Sarlatan. Don Sultan TV. Virgie Costillas. And thanks, Sister Virgie, for continuing your membership this month. Salamat po. And mega love shout out po sa ating new member, Myla De Los Santos. Yan. Ayan guys. Okay. So maraming salamat po sa inyo sa pag-attend sa ating Dialysis Warrior live stream. And we talk more about health and dialysis and how we can improve the quality of life for dialysis patients. And po, maraming salamat po sa inyo sa pag-tune in. At later on po, at 10 p.m. Pinas time, meron po akong another live stream which is open lang po. We'll have a guest. Ito po ay ating Karaoke Friday, and we'll have a guest named Glenn Bonifacio. And I will introduce him. If you want to go up and join us po, you're happy to come, to join us. So again, maraming salamat po sa pag-tune ninyo, and I will see you again next week. Bye-bye po.